bonus question, does it grow back? Is there regrowth?
All right. Is there a regrowth? It's really difficult to know about this because they're not very, very long-term studies. They're not like 30-year studies that talk about this. There's some studies with few patients, like there's a study with 12 years of follow-up when they show that the no need of compression is maintained. But the thing here is two main factors. First factor, that the surgery is not the end of the road, should be the beginning of a new way of living without pain, without heaviness. So the patient needs to incorporate the sports in her daily life to keep a healthy nutrition. That's going to help a lot. And the second factor is how ambitious we're going to be in the surgery. If we're going to remove just a bit or be more conservative, or if we're really going to do like a surgery which is ambitious and we're going to remove a lot of volume. In my opinion, if the surgery is ambitious and we remove a lot of volume, leaving that very thin layer, and if the patient has a healthy lifestyle, the chances of this to grow back are minimal. But still, it's a matter under study, and we need more data to know about the long-term results of this.
And does regrowth appear in other affected areas?
All right. Concerning other areas, more than a regrowth, I would say growth. Because if, for example, you already have lipedema in arms and you treat legs, the arms are going to follow its own pace and we know that lipedema, it's more or less progressive, so slowly maybe they're going to increase a bit. Also, there's the factor that when you treat the legs, everything's untreated, everything's very proportioned, but when you treat the legs and the arms still untreated, when you look at yourself in the mirror, visually it points out a little bit more, even if they have the same size. And also the surgery implies certain amount of inactivity, so you're going to gain some volume and some weight during the first post-operatively. So more than speaking of a regrowth, I would say like a proper growth. Still, it's under discussion if there's like a compensation mechanism or not. If when you treat the legs, the body feels that you're emptying like the warehouses of fat that it has, and then it's growing more. What I frequently see that the patient that already have lipedema, they also become more aware of their pain, of their heaviness, and they used to have a lipedema in the arms. Most probably, it's likely that they're gonna ask for a surgery in the arms as well.